Hello, everybody. I'm Dr. Michael Reiner, and thanks for joining us tonight on the Independent Doctors of Pahrump. Tonight, I really wanted to continue my introduction of different independent practitioners as well as practices in town. And tonight, I wanted to talk about one of the associations that I have is with Comfort Hospice. As we know, the hospice is one of those things that unfortunately is necessary in a lot of people's lives. But sometimes, you know, the talking of death and dying is kind of a morbid subject, and people don't like to talk about that. But one of the things I want to do is kind of dispel maybe some of the rumors about hospice or some of the myths about hospice, some of the things that hospice can and does do for patients to make the end of life journey certainly a lot easier than it can be. And we live in a community, as I found out when I first moved here, that there's not a lot of services and there's not a lot of support for people. And we find that as health deteriorates and systems get older and patients get older, that we need help. And in today's world, when they start to cut back on services and limit the amount of things that are available to patients, sometimes hospice becomes a useful tool in providing patients care. And as you know, hospice is supposed to be the end of life, but in reality, it can be any disease state where the question has to be asked is, would you be surprised if your patient, whoever that may be, might expire from some illness in the next 6 months? And while no one really likes to admit that there's a possibility that they could die in the next 6 months, when you really cut through the kind of veil of cure, and what I mean by that is I'm going to live forever. And when you finally get through that denial and you come to the reality that that life is not what it used to be and my health is fading and that I do need certain things, and yes, I might die in the next 6 months, then hospice might be one of those services that might be available to you. So during tonight's talk, I want to talk, I brought with me one of the nurses that I work with, Barbara. She's been a RN for, I think, 29 years. Yes. And she's been with Comfort Hospice here in the last, year? Yeah. She's also worked at Desert View for the past 3 years, regional hospital, and then took on a position as a case manager with Comfort Hospice. Prior to that, she was a case manager with HPN down in Las Vegas. And prior to that, you were an ICU nurse. Yes. So you've been in the field for quite a long time. Longer than actually I've been a doctor, yeah. Which is about... Thank you. That's good and bad, right? But no, I enjoy working with Barbara, and she's an excellent nurse. And so as we go through and talk a little bit about hospice, we're going to share some of those experiences that we've had, how we make differences in people's lives, and how we do bring help to them. And in fact, one of the other myths is that, you know, when you finally break through the veil of denial about people's mortality and that they might expire, when you do bring in the services that we provide, which we'll discuss that a little bit later, we actually see patients getting better. And it becomes a dilemma after 3 or 4 months when you start providing services that really help them. They actually get better. I mean, they actually do improve. And a lot of the hospice referrals come from patients that are in the hospital. And they have a severe pneumonia, they have COPD, and we see a lot of chronic obstructive pulmonary disease, a lot of congestive heart failure. Our population is aging, we're getting older, and we're succumbing to that. And we've done a lot of great advances in medicine, but, you know, medicine doesn't keep you alive forever. No. And I always find that balance between quality and quantity of life. You know, we're always juggling, you know, and I have to have that hard discussion with patients about a lot of routine testing, you know, like mammograms and things of that nature. Well, if you're not going to get chemotherapy and you're not going to get surgery, then why go to the trouble to get your breast squeezed in the next week?
Right.
It really doesn't make sense.
No.
So that's one of the things that I like about having that heart-to-heart discussion with patients, because you really can get to the bottom line. And then once they get into that mode where they admit that they might expire, then they accept what hospice. And hospice was created in 1980s, and unfortunately back then it was an elementary program. A lot of it was free, and then Medicare listed the Medicare hospice benefit. So it's a Part A program. It's not a Part B program, and not a lot of people understand Medicare. I certainly don't claim to be an expert in Medicare. I'm an expert in what I do, but when it comes to insurance, I leave that up to the insurance brokers and the government people,
right.
And the billers. And so but the benefit as it exists is a Part A. It's a hospital benefit program. And if you have Medicare, you can elect Part B, which is the doctors.
Right.
And you can elect D, which is the prescription program. But Part A, there is no election. You automatically get Part A program. Right. So even if you want, and I have seen them, I didn't think it was possible, but there are people that elect not to have the $100 and so deducted from their check every month, so they don't elect Part B that covers doctor's offices, but they still are eligible for Part A. Everybody is eligible for Part A if you're eligible for Medicare. And so everybody has a Medicare hospice benefit that's on Medicare, and that's something that not everybody completely understands also. But those diseases, whether it be congestive heart failure, whether it be COPD, we have a lot of people who that were young in the 40s and the 50s, and you just did not walk around without a cigarette in your mouth. Right. That was just something that everybody did. If you didn't smoke, there was something wrong with you.
Exactly.
I grew up and both of my parents smoked, and it was just commonplace to have everybody have a cigarette in your hand. And nowadays we're dealing with a lot of chronic obstructive pulmonary disease, a lot of congestive heart failure, a lot of cancers, unfortunately. Right. And as we live to be older, our immune system can't fight off the things that we used to fight off, and so we see a lot of cancers. And what we're going to talk about is the myth of hospice. And the myth of hospice is that they put you in a room and they give you a lot of morphine and you die. Right. So we're going to go to break, and when we come back, we're going to open that discussion. And I remind you that this is a call-in tonight, 727-8750, and we'll be right back. Thank you very much for tuning in tonight.